Hi guys, my name is Carl. My pre-med is BS Medical Technology, and currently I am a first-year pathology resident. I initially wanted to do something clinical, particularly neurology. I did apply for neurology residency program and got in and started in January this year, but as I kept going through the duties, I was slowly starting to realize that maybe that wasn't the specialization for me. But I did also consider the fact that maybe I was just rushing myself. Maybe I was just in the adjustment period. Eventually, I did start getting severe burnout. So I thought, okay, maybe it was best for me and for the patients that I was assigned to and I was taking care of to just give myself a break and not force myself through it, especially if it wasn't or it didn't seem healthy at the time. So after a week of residency, I decided to quit and give myself a break. And during that break, that's when I ended up doing moonlighting jobs. I did reliever jobs in as a company physician. Also took a hospitalist role. But as I was doing my moonlighting jobs, it became more apparent to me how maybe the clinical side of medicine wasn't for me. It was hard to accept because as a first generation doctor in the family, there's some level of expectation that I would go into the clinical side. Kasi syempre mga kapamilya, they'd ask you for help pagka sila may sakit, kapag may nararamdaman sila kung pupuntahan. So there's that level of expectation. But I was trying to gauge myself and I was starting to realize maybe the clinical side of medicine wasn't for me. And that's when I discovered or took into consideration pathology. And I would always say that pathology was one of the things I took into consideration for, because I had the background of medical technology as my pre-med. So I was like, okay, maybe I'll give it a try. And then that's when I inquired here in the institution I'm training in. Pre-residency was 1 month, so it was a good gauge of whether or not this is something I like. And lo and behold, I got accepted, and here I am in my first month of residency program. First word siguro, overwhelming. I'm pretty sure all programs are very overwhelming. There's a big shift in responsibilities and tasks from being an intern or a clerk to a full-on resident. But I think at least in terms of pathology, overwhelming siya kasi nung intern or clerk tayo, very limited lang yung exposure natin to pathology. Sa amin, parang elective lang siya, and if I recall correctly, 2 weeks lang. So it's a very short amount of time to be exposed to the world of pathology. So when I got into, when I started my pre-residency and I was shadowing my seniors, watching them sign out their cases, when I was looking through the microscope with them, they would describe the structures, the architecture, yung mga cells. I'd be like, oh, what am I looking at? Parang ganon. So it's very overwhelming, but in the same light, challenging rin talaga siya. Challenging syempre mentally, kasi there's a certain level of expectation that you have to uphold, kasi hindi ka na student resident ka na talaga. You're actually responsible for these patients, you're responsible for these cases. So your seniors, your consultants expect you to have a certain level of competency. So challenging siya mentally kasi you have to study, always study talaga even if there's no time. I know a lot of friends who are in the clinical side of medicine na parang talagang pinipilit pa rin mag-aaral even despite their hectic duty schedules. And well, ganoon naman talaga, no? Tapos, it's not just challenging mentally, but also physically. Syempre, there are specialties who expect you to stay in the hospital for long periods of time. As in, yung hospital na yung bahay nila. Tapos, sumasaglit na lang sila sa bahay para maligo. matulog, tapos pagkagising, balik na naman sa ospital. So, very challenging rin siya. It challenges your grit as well. Kasi yun nga, I think residency really brings you and challenges you, asks you if this is what you really want. And when those hard times come, well, dapat talagang confident ka na despite everything you're facing, despite hardships, wala, ito talaga yung gusto ko. So, like, I'll be able to push through this, and eventually you're gonna grow and flourish in residency. Here in the Philippines, dalawa kasi yung, we have a dual program. We train for both AP, so that's your anatomic pathology, basically yung histopath side ng lab. So, kunyari, nasa OR kayo, may lab cole, na specimen out nyo na, tapos papasabi ng consultant for histopath nyo yan, or tabiso, for histopath yan, may fill upan kayo yung form. So, yun yung napupunta sa amin, gugross namin yun, and then once ready na yung mga slides, then we read it under the microscope, eventually sign out with the resident, and sign out with the consultant. But that's not it, hindi lang naman surgical specimens yung mga hinahandle namin, meron rin kami mga iba't ibang mga biopsy specimens, meron kaming mga frozen sections, to name a few. So there's a lot of variety in AP. No? Kaya it can be very overwhelming. Marami ka dapat binabasa, not just in the microscope but also in textbooks, kasi syempre there's a variety of cases that you encounter per day. So parang more or less dapat ready ka. And then on the other hand, yung CP side, which is where I'm rotating in, is yung clinical pathology. So that's basically the rest of the lab. Hema, clin chem, immunology, serology, clinical microscopy, blood bank. Dito sa institution namin, meron ng molecular diagnostics. Either way, AP or CP, dito sa amin, nag-start ang duty namin officially ng 8 a.m. So, ako personally wake up at like 6:30, 6:45 to get ready, take a bath, and then leave the house ng mga 7:15, 7:20. Kasi travel time ko from the house to the hospital, mga 20 minutes, more or less. So, arrive in the hospital mga 7:45. And then, sa amin, CP, usually we'd receive yung endorsements ng outgoing na 24-hour duty na CP rotator. So, yes, sa amin, nagta 24 hours yung CP rotator. And amongst CP residents, meron mga naka-assign sa amin na mga sections. So kunyari, assigned ako sa blood bank. Then another resident is assigned to hema, another resident is assigned to clinical microscopy, etc. etc. So may ganun kasi, kunyari may concerns or may referrals from those sections, kayo yung may responsibility to attend to those referrals. And if may mga concerns, kayo yung mga tatanungin ng mga medtech natin, mga recept, no? So kayo yung pupuntahan nila. Usually yun yung mga inattendan mo up until 5 p.m. Our duties 8 a.m. to 5 p.m. So kapag 5 p.m. tapos hindi ka naman 24-hour, then uwi ka na. However, if you're 24 hours, mag-stay ka. And at that time, since alis na yung mga kasama mo, ikaw na yung mag-handle lang lahat. So, kunyari ako, 24 hours ako ngayon, ako yung nag-attend sa lahat ng mga referrals. May referral sa hema, like may peripheral bloods yung kailangan basahin, so ako na rin yun. So, hindi ka lang mag-aaral para sa rotation mo or sa assigned na section mo, but you also have to be familiar with the other sections as well. Kaya kailangan pa rin talaga mag-aral, kailangan mag-practice talaga, lalo na if may time ka. So yun, kapag 24 hours ka na, since 5 p.m. onwards, ikaw na mag-isa, ikaw na yung nag-handle ng iba rin mga referrals. Then, usually may mga papers kami sinasend, mga quality control, mga results, check namin if tugma ba yung mga nakatype bago siya ma-release. If may mga discrepancies ba, kami yung mag-check nun bago siya ma-release. Meron din kami mga specimen collection here in our institution. Kami yung mga nagko-collect ng mga certain tests for microbiologic testing amongst others. Tapos, ano pa bang mga ginagawa namin? So, yung 24-hour resident rin yung tinatawag namin na nagpe-prep or nagpe-prepare ng mga specimen na i-gross the next day. So, we do all this before 12 midnight para lang medyo may time ka makapagpahinga. So, among CP rotations, heme yung pinaka-toxic. Marami kasing referrals sa heme. Yung mga referral blood smears na pinapa-double check. Yung pinapa-double check kung may blasts ba. No? So, ikaw yung magdi-diff count. So, yun, dapat familiar ka sa mga differences nila ng mga different types of WBC. Is it already a blast? Is it a lymphocyte? Minsan mahirap. Pero familiarization na lang talaga through practice, repetitive practice. Tapos, magre-receive ka ng mga bone marrow specimens, mga lymph node cases. So, under heme rin yun. So, as a resident, consultants expect you to screen. Okay lang naman kung mali, especially first year. Lalo na ako. First month ko pa lang, so I still have a lot to learn. But they still expect you to screen. So, tapos syempre, self-conducted learning rin yun. Bago siya makita ng consultant mismo. And then, ayun, pagdating ng 12 midnight, pagtapos mo na yan, yun pa pala, isa pa pala sa responsibility ng 24-hour resident is if 5 p.m. onwards, pag may frozen section, kami rin yung nag-handle nun. Although technically AP siya, di ba? Kasi parang tissue sample. But since 5 p.m. onwards, CP resident na, yung 24-hour resident na yung may responsibility doon. So, if ever meron man sa gabi, so, kami yung nag-handle nun. And then, we'd inform, update our consultant, and then relay the diagnosis to whichever surgical specialty yung nag-request nun. And then yun nga, pagkatapos na lahat yan, na-prep mo na yung mga specimens mo for grossing the following day, pwede ka na matulog. Yes, nakakatulog kami. Thank goodness. Although, always on the lookout kami kasi minsan may mga, dito kasi may ER referrals rin ng mga parang outlier labs. So, pagka ganun, pinapa-double check sa aming mga residents yung mga results. They ask us which results to release. So, after nun, gigising ulit. Ako usually makatulog ako ng mga 1. Earliest ko na yung 1. Gigising ako ng mga 5:30 para mag-check ng mga referrals if I missed anything. And then, I start doing yung mga morning responsibilities ko. Usually yung mga quality control na yan ng mga iba-ibang mga sections, mga HEMA, CM, Chem. Magpapacheck na sila ng quality control. So, kung tayo yung magsasign nun. And then, usually yun na rin magdadagsaan na yung mga HEMA referrals for PBS screening, etc. And then, kapag 8 o'clock na, ayan, nadarating na yung mga co-residents mo. And then, you endorse yung mga cases na na-receive mo, specifically yung mga HEMA cases. If may mga need pa i-screen, may mga need ipa-stain. So, ayan, i-endorse mo na siya. And once you've properly endorsed, then you're pretty much good to go. So, yes, through from kami sa pathology, at least here sa amin, na kapag na-endorse mo na, pagtapos na yung responsibilities mo, MGH ka na. So, yun yung typical day ng CP resident. Sa AP resident, kasi hindi pa ako nag-AP. Next month pa ako makakapag-AP. So, I can't give a comprehensive description of yung day of a life of an AP resident. But from what I can see, yun nga, 8 to 5 pa rin sila. Ayun pa pala, sa CP kasi, hindi kami pre-duty from unlike yung other specialties na parang every 3 days duty ka. Sa amin, parang nakaschedule lang. So, kunyari ako, duty ako ngayong Wednesday. So, from ako on Thursday. Not necessarily, duty uli ako ng Friday. Ang next na duty ko na is Sunday. So, there's no pattern. Parang depende na lang kung sa schedule mo kung kailan ka 24 hours. So, pag natapat na hindi ka naman 24 hours sa weekend, edi wala kang pasok. Yeah. Sa AP, ganun rin. 8 to 5 lang rin yung pasok. Tapos usually weekends wala rin. Unless assigned ka at a certain assignment in AP, which is a whole story. Hindi ko na kaililitahin. Pero in general, 8 to 5 ka lang. And then, wala kang pasok kapag weekend. Ideally, pumapasok ka mas maaga, especially if grocer ka. Kasi yung grocer, so yung grocer yung basically tumatanggap ng mga surgical specimens and then yung nag-gross examination nun. And then, kami yung mag-prepare nun into, separated into blocks. And then, yun yung magiging microscope slides namin, which is babasahin namin the following day kapag sign out ka na. So, i-screen mo siya, babasahin mo yung mga cases mo, na ginross mo. And then, you sign out with the consultant. And then, marami pa yan. Marami pang mga responsibilities yung AP. Pero, more or less ganun yun. Mas hectic siya kasi depende kung gano'ng karami yung mga surgical specimens nyo eh. So, kunyari, masipag yung mga surgeons this day. Eh di, malas ka. Mas often nag-overtime talaga sa AP. Depende na lang. Lalo na kapag sa simula. Lalo na kapag ako nag-AP na ako. In-expect ko na mag-overtime ako kasi syempre, hindi ka pa ganun kabilis mag-screen. Hindi ka pa ganun kabilis kumilos. Ginagamay mo pa yung mga ginagawa mo. So, it's gonna take some time. So, yeah, that's basically the life of a patho resident in a nutshell. The hardest part in residency is the adjustment period. Yeah, like I mentioned before, in pathology kasi sobrang nakaka-whiplash yung change ng environment mo. Kasi diba, nung clerkship, ng internship, for the most part, talagang kayo sa clinical, sa surgical side, nakafocus ng mga rotations. Yun yung mga major subjects eh. And then, biglang pagbagsak mo, pagpunta mo ng pathology, sobrang iba. Sobrang iba ng practice. I mean, oo, merong work-life balance. I mean, nandun talaga siya, pero ang dami mong kailangan aralin kasi marami kang hindi familiar na mga concepts. Although ako nabasa mo siya sa med school, pero iba pa rin kapag nakita mo na siya in real life, under the microscope. Kapag nakita mo na siya, parang it's, namamind block ka talaga eh. Namamind block ka. So, para sa akin, yung pinakamahirap na ma-adapt is yung catching up with the things you have to know. Buti na lang I have very helpful seniors who are very open to teaching us yung mga iba-ibang mga concepts. Pagka may mga interesting cases may napabasa sa amin, tapos sinutunan kami. So it's very helpful. Pero syempre, iba pa rin kapag nag-aaral ka by yourself, in your own time, in your own pace. Para sa akin, yun yung challenging. Yung pag-adjust talaga from internship to residency. Pero very fulfilling sa akin yung makikita yung growth mo. No? From, I mean, it's hard to say for myself kasi kakastart ko pa lang. 1 month pa lang ako. Pero, I mean, siguro in that 1 month, medyo nakita ko na yung growth. Although CP pa lang naman ako, pero kahit pa paano naman, I can see some improvement na kapag-adapt na ako kahit pa paano. So, workflow, although I still have a lot to learn, but you know, the growth is there. It's very fulfilling. Kasi, yun nga, makikita mo, if you look back, parang, yun nga, nag-grow ka as a specialist in your respective field. And then, at least for me personally, inspiring rin to see how my seniors work and approach things kasi parang naisip ko na parang someday I'll be able to achieve that level of competency and di ba parang nakaka-inspire na parang balang araw kaya ko rin yun or balang araw ako na yung magtuturo sa mga juniors ko, balang araw kaya ko na rin mag-sign out ng mga cases na ganito ka-confident, di ba, or parang kaya ko na mag-offer ng mga iba-ibang mga differentials. So yeah, I think that's what's very fulfilling, especially in the field of pathology, is being able to have that adept level of knowledge sa mga cases mo. huwag nyo nang pag-isipan, mag-apply na kayo. Hindi, joke lang. Sa mga interns and clerks, siguro make the best of your rotations. Yun nga, tulad ng nabanggit ko, very, very fast lang yung elective rotations nyo. Alam ko, chill lang siya. And usually, yung elective rotations yung pahinga natin di ba? Pero, I mean, kung gusto mo talaga pathology, diba? Why not take the extra effort? Karoon ka ng initiative. Kunyari, may mga yung senior mo nag-gross, pwede kang mag-observe, or if papayagan ka, ikaw mismo yung mag-gross, talaga yung mga run-of-the-mill specimens lang, para lang medyo gabay mo na yung mga ginagawa mo, diba? Na gagawin mo for the next 4 years, or the rest of your life, basically, maging pathologist ka talaga. Tapos kung kunyari may mga interesting specimens under the slides, pwede mong picturean yung mga slides. Tapos, kaya mo siyang ma-identify. Pwede mong ipagyabang mo sa mga clerk, intern mo na, ito, tingnan mo to. Ito yung orphan nuclei, di ba, sa PTC. Mga ganun. So, parang, parang really dive into or make the most of your rotations. But, otherwise, I think, ang pinaka-ma-advise ko is don't pressure yourself na alam mo na agad dapat kung ano yung specialty mo. I think yun yung tendency kasi na parang may expectations na parang ka sa mga interns na dapat by now or at this moment parang dapat alam mo na or more or less may idea ka na kung anong specialty ka. Pero I advise not to pressure yourself too much. Kasi minsan, take it from me na may tendency kasi na hindi angkop yung magiging desisyon mo para sa sarili mo. So, pwede kang mag-spiral down, confuse ka, ma-burnout ka lalo. So, really just enjoy where you are right now. So, if clerk ka, enjoy mo yung time mo with your co-clerks, your friends. If intern ka, enjoy mo yung time kasi medyo free yung time ng interns, di ba? So, if moonlighter ka, enjoy rin yung time moonlighting tsaka yung sweldo. So, yung eventually, once you're ready, you'll feel that you're ready, diba? Tapos pagka nagpi-pre-res ka na, yun rin, make the best out of it rin. Whatever program you may be applying to. Kapag nagpi-pre-res ka na, really take the extra effort as well to gauge whether or not that program is for you. Kasi pre-residency is not just the institution checking if you're the right applicant for them. It's also you checking if it's the right program for you, diba? So, yun. Otherwise, talagang enjoy the moment lang kasi hindi ka na babalik sa pagka-clerk, hindi ka na babalik sa pagka-intern, diba? Pagka-resident ka na, tuloy-tuloy na yan. Kapag consultant ka na, tuloy-tuloy na yan. The responsibilities just keep stacking up. So, eventually, we get used to it. Eventually, we grow as specialists, as physicians. So, really just, at least at the moment lang, enjoy where you are and be proud of yourself lang.